TPIRC is a very unique place where we develop cutting-edge treatment to treat orphan diseases, especially for food allergy. We had a huge success through SoCal Food Allergy Institute.
Here at the Southern California Food Allergy Institute, we treat food allergy. Our goal is to actually treat them in a way that is without medications or pills or injections, but to actually treat their immune system with the foods that we actually want them to ultimately be eating, but with a back of actual research data to actually help drive our clinical treatment.
Already we've had thousands of patients come through our tolerance induction program, and already we're seeing a very positive output of their biomarkers, meaning they are achieving a tolerance state. Now what's exciting for a researcher or a scientist to come in and do is help to define what exactly those mechanisms are.
Looking at the basis of where our company is founded on, it is on big data analytics. And with that has come the challenge of replicating a process that is done largely by one individual, Dr. Randhawa, and being able to develop that into machine learning, which we have now been able to do.
A truly unique thing about TPIRC is the way the clinic helps the research lab, and then the research immediately helps the clinic so that we could affect patients' lives immediately rather than 10 years down the road.
Right here we have the research center located in the same location as our clinical center, which means that our research department has very easy access to that data.
All the clinical treatment, we are measuring these patients across time, how their body is responding to these food proteins that we're introducing over time to actually change the way their body sees these proteins.
TPIRC has three aspects: data, research, and patients. But think about it as a circle. In the middle will be patients. Patient experience is our number one priority.
I would say as a physician, all of us went into medicine to actually help patients. And this is one of the places where it is a unique opportunity to actually be on the forefront of medicine, the forefront of research, and actually being able to apply it directly to patients and their lives.
When we are building a software platform, we're not building a platform that just makes the process easier for our staff and integrates things. It's actually, how does what we build impact the patient care?
Every day I come into work and I get to see the patients that are coming in that have lived in fear previously from their food allergies, and now they're getting that treatment. So that's a great motivator for me. And also from a selfish standpoint, it's just amazing the serological samples that we could get from these patients that then could lead to decades of research.
What we do here is a constant feedback of trying to take that information and actually apply it in the clinical setting so that we can make a difference now.
I get to see that on a daily basis, and so I think the unique opportunity of working in an organization that is actually pushing to change the way medical centers operate is in and of itself a unique opportunity, but to see the immediate impact of having designed a software system that builds a seamless process for a patient to come through here is very impactful, and it offers a different meaning to working in a informatics and software development team.
It's really been exciting for me to watch scientists come into TPIRC and be able to expand into their positions and really find a project that they're passionate about and then carve out a role for themselves here at TPIRC.
As a physician here at the Southern California Food Allergy Institute, you get to see and participate in so many stories where, families come in, very limited diet, very limited lifestyles, with a lot of fear and anxiety, and watching these patients grow to make these steps throughout the program towards their food freedom is very rewarding. We do have a significant success rate, which is obviously why we are continuing to grow.
This year, we are going to open our satellite clinics to give our patients more access to our program.
What we're doing here in Long Beach, we want to actually bring to all the patients that have food anaphylaxis, to all the other major cities of patients that are suffering from this condition.
As the company looks to expand to every major metropolitan city in the US and on, is very exciting, very challenging, but it brings on new opportunity of growth in the company itself.
We have all these different core facilities that allow us to ask and answer a lot of different questions that apply to various disease states so that we can focus on some rare or orphan diseases.
What we are looking for are leaders, educators, people with inquisitive minds that want to learn and that want to make a change in medicine.
We are entrepreneurs. we are creative, and we have analytic mindsets.